And welcome into To Your Health. You know, as you age, a lot of things are happening from a medical perspective, but also that muscular skeletal system of your body is aging also. Today we have with us Dr. Thomas Lindsey, and you are basically a family medicine doctor with a specialty towards sports medicine.
That's correct. I appreciate you
So
having
when you're
me.
getting into sports medicine, it's basically athletes. And mostly the things that happen with them is injuries, would you say?
Injuries, yeah, and a lot of it, some chronic musculoskeletal problems
Okay.
can develop with them as well.
A very interesting thing. They were talking about the fact that at one time, that when children are starting to get into sports earlier, that conditions can live with them through life. Is that a myth, or is that kind of a...
Certainly if the sport specialization, so children that specialize in certain sports early on, put them at risk for some of the problems, particularly like in baseball, the earlier pitchers.
Yes.
So if they specialize in sports and do that year round, they can be at increased risk for certain things like little leaguer's elbow, little leaguer's shoulder. So it's important to get kids involved with multiple sports and not let them specialize too early.
So, and as we're aging, and obviously we're having our medical problems addressed, when you're looking at that patient, you probably take a more holistic approach to their entire body.
Definitely, I think that's part of the osteopathic physician philosophy. That's kind of how we're trained. And, you know, I think I'm a little bit unique in that I have an osteopathic manipulation fellowship too, so I can treat things manually that my other physicians might not be able to.
And that's usually a good way to do it, because then you're taking out the having to use a drug.
Correct.
And that's, of course, and that's one thing we're trying to get away from as much as we possibly can, especially as people age. They don't need to be as drug dependent, do they?
No, I see more and more patients on anti-inflammatories long term. Certainly there's major risk factors with that. People can get stomach ulcers and have bleeds, and it can affect your blood pressure and kidney function as well. And so those are medicines that a lot of people are on that they don't need to be on.
And it's not only the medicines, but it's also over-the-counter different pain relievers. That becomes a factor, doesn't it?
Yep. Unfortunately, there's a lot of over-the-counter medicines that people have access to that they don't necessarily need to be on. One of them being anti-inflammatories.
Absolutely, because you think it's going to be taking care of something, but it's always short term, isn't it?
Usually.
Yeah, and in your case, you can kind of treat the symptom and find a better way of taking care of it.
Exactly, yeah. I think it's, you know, certainly it's not a end-all be-all treatment, but I think it's definitely a good alternative to medications.
And when we talk about the term like family medicine, basically that means you're not going to, you can see younger people in the family as well as the parents and even grandparents.
Yeah, so in residency we took care of infants all the way up to elderly. So I've had experience with all of it. The practice, I'm accepting new patients ages 5 years and up right now.
5 years and up. Well, that is sure the whole family then, isn't it?
Pretty much.
And
yes,
you
sir.
had a very unique opportunity to work for a year with the University of Alabama. All their sports programs or just the football program?
So I worked with all the sports except men's baseball and men's basketball. So really a good opportunity to see a wide breadth of athletes and some of the problems associated with those. Got to work with the dance team, gymnastics, football, women's basketball, among other sports.
And of course, they're more apt to have an injury the more they're involved in something.
Definitely. I mean, the college athlete is a whole nother athlete level from going from high school to college. They have practice more often. The expectations are a whole lot higher with college athletics, so certainly they're more prone to injury.
And when they're in the heat of the competition, it's a little bit more strenuous, is it not?
Yes, sir.
Absolutely, absolutely. So if one of our viewers would like to have an appointment, they can just call your office?
Yes, sir. Our number is 334-213 3606, and we'll be happy to talk to them and get them an appointment.
And accepting new patients 5 years old and up right now.
Yes, sir.
Well, good. Thank you so much for what you're doing. And remember this, preventative medicine is probably one of the best things you can do. If you feel anything that doesn't seem right in your body, it's your body. Make sure you let it be known to a physician. And you should have a regular physician so you build a baseline. We'll be right back right after this.